Bismillahirrahmanirrahim. Welcome to my channel Science of Life with Dr. Mohammed Yusuf. Today I'm going to discuss the last part of our this long discussion of long-term regulation of blood pressure. The role of renin-angiotensin system. We talked about the role of renin-angiotensin system in the intermediate mechanism, but it has got very important role in long-term as well. But before that, one ayah from Holy Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وإن تطع أكثر من في الأرض يضلوك عن سبيل الله إن يتبعون إلا الظن وإن هم إلا يخرصون وإن تطع और अगर तुम पैरवी करोगे अक्सर मन फिल अर्द जमीन में जो अक्सरियत में है दुनिया में ज्यादा लोग ऐसे हैं कि अगर आप उनका कहना मानेंगे युज़िल्लूका अन सबीलिल्लाह तो वो आपको अल्लाह की राह से हटा देंगे, अल्लाह के रास्ते से हटा देंगे, गुमराह कर देंगे। वो इसलिए कि इन यत्तबिऊना इल्ला ज़न्ना, उनका माज इसलिए है कि वो माज अपने बेअसल ख्यालात पर, अपने जन पर वो फैसला करते हैं। ये जन है ना कि ज्यादा लोग जो कहते हैं वही ठीक होता है, ऐसे नहीं है। हक हक होता है, चाहे उसको ज्यादा लोग कहें या थोड़े लोग कहें। ये लोग ये अपने जन पर इन यत्तबिऊना इल्ला ज़न्ना, ये तो अपने जन की पैरवी करते हैं, अपने गुमान की पैरवी करते हैं। व इन हुम इल्ला यखरुसून, और ये बिल्कुल ख्याली और कयासी बातें कर रहे होते हैं। ये तसव्वुर के जो ज्यादा लोग कहते हैं वो ज्यादा वही ठीक होता है, ऐसा नहीं। ऐसा तो दुनिया में अक्सरियत, आम तौर पर दुनिया में ज्यादातर लोग ज्यादातर वही रहे हैं जो अल्लाह की राह से हटे हुए होती। तो ये सूरह अल-अनाम की आयत है 116 कुरान पाक में। इसकी मुख्तलिफ तफासीर देखें कि ज्यादातर लोग दुनिया में जमीन पर वही लोग रहे हैं जो हक से हटे हुए होते हैं। हक के 100% फॉलोअर जो है वो हमेशा थोड़े होते हैं। तो हमने पैरवी किसकी करनी है? जो हमें रिवील किया गया है, जो अल्लाह की तरफ से वो हदायत याफ्ता लोगों ने जो बता दिया वही हक है। तो अल्लाह पाक हमें इस बात की समझ दे कि हक की पैरवी हमने करनी है, अक्सरियत की पैरवी नहीं करनी। अल्लाह पाक हमें समझ दे। So we are going to talk about the role of renin-angiotensin system in long-term regulation of blood pressure. We discussed the role of angiotensin. उसको हम दोबारा we are going to mention that is the vasoconstrictor effect, which is important for the intermediate mechanisms. One of the intermediate mechanisms is renin-angiotensin system. This renin, as you know, it is kidneys control the blood volume. We discussed in the previous 2 lectures the role of kidney, the primary role of kidney for the increasing or decreasing the extracellular and fluid volume and blood volume for the maintenance of the blood pressure. Renal body fluid system, we term that. So besides controlling the blood fluid volume, kidney have got role in the production of this renin as well. So renin, kidneys also contribute in blood pressure homeostasis through the renin-angiotensin system. Vasoconstrictor effect we have discussed, and कुछ और बात आज हम करेंगे. Fall in the blood pressure causes production of renin from the kidney. ये भी हमने पहले देखा हुआ है. Whenever there is fall in the blood pressure, renin will be produced from the juxtaglomerular cells, and that will cause the vasoconstriction, intermediate mechanism. So fall in the blood pressure, where this renin is being produced from the kidney में fall in the blood pressure, इसको ध्यान में रखें. The renal arterioles में अगर blood pressure fall करता है, then there will be more production of renin. So fall in the pressure causes production of renin from the kidneys, and the renin is a protein enzyme. We know it is produced from the juxtaglomerular cells. We are going to see the diagram as well. But this renin has got multiple mechanisms. Renin has multiple ways to affect the blood pressure. One is vasoconstrictor, which we discussed in this previous lecture in the intermediate mechanisms where we discussed. This is the that diagram we have already seen, where the distal tubule is passing between the efferent and efferent arterioles. It is in contact with the wall of the vessels. This tubule is in contact with wall of the vessel. This is efferent arteriole, this is efferent arteriole, and the cells of this tubule where it is in contact with the wall of the vessel, they are known as macula densa. And the cells in the this muscle, the arterioles, they are known as granule cells, and this whole apparatus is known as the juxtaglomerular apparatus. Or from these cells, there is production of renin. So this is the that apparatus, juxtaglomerular apparatus, comprising of the efferent arteriolar part of the efferent arteriole, or even the efferent arteriole, and this macula densa of the tubular cells. Yes, are milker. This is the efferent arteriole. Whenever there is fall in the blood pressure, the general mechanism जो हमने पहले भी शायद बात की हुई है, whenever there is a decrease in the blood pressure, renin will be produced from the kidney, and renin substrate in the blood, which is the part of the plasma protein, this which is produced by the liver. So that is known as angiotensinogen, or you can call it renin substrate. Renin will act on that, and it will convert it into that is also protein. Angiotensinogen is a protein, but some amino acid will be cut. This is the renin will cut some of the amino acids, and a smaller molecule will be left, which is known as angiotensin 1. This angiotensin 1, when it is passing through in the blood through the lungs capillaries, in the endothelium of the pulmonary capillary, there is an enzyme which is known as angiotensin converting enzyme, which will convert this angiotensin into angiotensin 2. Angiotensin 1 is converted into angiotensin 2. This is the active for the retention of salt and water, and this is vasoconstrictor. We discussed this vasoconstrictor effect in the intermediate mechanism when we were discussing it. So the angiotensin causes vasoconstriction, as well as it causes the retention of salt and water by the kidney, which we are going to see today. ये कैसे काम करती है? So vasoconstriction and retention of salt and water both will cause this increased blood pressure, increased arterial pressure. The fall in the blood pressure has been corrected, renin angiotensin system has contributed for the homeostasis of this homeostasis of this blood pressure, maintenance of this blood pressure. This diagrammatically, blood pressure, when there is reduction in the blood pressure, renin will be produced from the juxtaglomerular cells. Angiotensinogen produced by the liver is already present in the blood, that will be converted into angiotensin 1. This in passing through the lungs, angiotensin converting enzyme will convert it into angiotensin 2, and this causes vasoconstriction. This is the intermediate mechanism. Long-term regulation this is important. It will cause the adrenal cortex to produce aldosterone, plus this angiotensin itself has got the effect on so this aldosterone will cause the absorption of water. We are going to see this aldosterone causes absorption of water, absorption of sodium and chloride and bicarbonate and water, so increasing the blood volume. And angiotensin also stimulates the ADH and thus mechanism as well to increase the blood volume as well. ADH को भी produce ज़्यादा करेगा, और thus mechanism will operate, and it will cause the more intake of water, and the blood volume will be in this. So that is ये दूसरी diagram भी देख लें, the same diagram, angiotensin 2. So this is causing the aldosterone is causing the increased reabsorption and decreased urinary volume and increasing the blood pressure, retention of salt and water, aldosterone का काम. So angiotensin 2 vasoconstrictor effect we have seen. It causes the arteriolar constriction, will cause the increased peripheral resistance, and it will cause the increased pressure that we have already discussed. it may have got some effect on the veins as well. Venoconstriction, if it can cause, it will increase the venous return, it will reduce the total capacitance, total capacity of the, so there will be increased venous return and cardiac output and blood pressure will increase. But this is more important. Vasoconstrictor effect causes the increased peripheral resistance and increased blood pressure because blood pressure is proportional to peripheral resistance. Now, decrease excretion of salt and water, the other mechanism. Retention of salt and water mechanism by this renin-angiotensin system. Angiotensin causes retention of salt and water by aldosterone and by its direct effect. And so decreased excretion of salt and water will cause the increased extracellular fluid volume, and that will increase the blood volume, and that will increase the venous return, and that will increase the blood pressure. So both mechanisms are there for the control of this. This mechanism, the second mechanism which we are talking today, हमने kidney discuss किया. Kidney is responsible for the control of blood volume, extracellular fluid volume. This is also through kidney ये काम हो रहा है. There is more retention of salt and water by the renin-angiotensin system as well. We discussed the role of kidney, that is the property of the kidney. वो kidney का अपना काम है. But angiotensin also contributes for the more retention of salt and water. This function of retention of salt and water is more powerful than this one, the vasoconstrictor effect, the intermediate mechanism, and it is more prolonged as well. That's why we are including it in the long-term regulation of the. This may be, this is powerful and more prolonged than the vasoconstrictor effect of the angiotensin 2. When there is hemorrhage, we are proving this, the role of importance of this renin-angiotensin system. If there is hemorrhage, blood pressure falls. We are going to see कि होता क्या है. Experimental animal में हम करके देखते हैं कि angiotensin, what the angiotensin is doing. What is the importance? What is the level of importance of this renin-angiotensin system? If some severe hemorrhage occurs, of course the blood pressure will fall. Blood pressure may fall to half the 50 millimeter of mercury. Blood pressure has fallen. If the renin and angiotensin system is intact, this 50 millimeter of mercury, this will be corrected by when the renin angiotensin system is intact. Blood pressure will raise to about, we are going to see the diagram as well. हम आगे diagram देखेंगे, but let me explain. That is 50 millimeter of mercury. If the renin-angiotensin system is intact in that animal, we will observe that his blood pressure may rise up to almost 83 millimeter of mercury, which is sufficient for the survival of the animal. 50, so this is sufficient. So 83 millimeter of mercury. But if without renin, if we block the renin-angiotensin system, well, we can very easily block the renin-angiotensin system by giving the ACE inhibitors. ACE inhibitors, what is that? Angiotensin converting enzymes in the pulmonary epithelium. Usko we can block by some drugs. ACE inhibitors, they are known as. ACE inhibitor, ACE inhibitor, so angiotensin will not be produced. If without renin-angiotensin system, this blood pressure may only be increased to only 60 millimeter of mercury. So this is important. With the angiotensin system, blood pressure is raised to quite a long way towards normal. Normal तो नहीं हुआ, but it has gone to 83 millimeter of mercury, and without this only 10 millimeter of mercury rise in the pressure we observe in that animal. This is that diagram. That is, if there is bleeding occurs here, blood pressure was 100 millimeter of mercury. If bleeding occurs and blood pressure has fallen to 50 millimeter of mercury, if the renin-angiotensin system is intact, then we are going to observe that is within about 20 minutes or 15 minutes, the blood pressure has gone to about 83 millimeter of mercury. So this is the importance of renin-angiotensin system, and it will maintain this 83 millimeter of mercury. by the retention of salt and water, vasoconstriction, etc. Sare, all the effects are simultaneously taking place. vasoconstriction भी हो रही है, thirst mechanism भी operate, ADH mechanism भी operate हो रहा है, renal retention of salt and water भी हो रहा है. So all is maintaining the blood pressure at 83 millimeter of mercury. And without, if we have blocked we had blocked the renin-angiotensin system, then the blood pressure would have risen to only this very small, that is, very low pressure. So this is the importance of renin-angiotensin system. Importance of vasoconstrictor effect of the angiotensin after hemorrhage. This is vasoconstrictor. This is taking within minutes की बात है, but it will continue in the long term as well. Retention of salt and water. Vasoconstrictor effect यहाँ show हो रहा है, within minutes जो हो रहा है. Intermediate mechanism जिसको हमने बात की थी. Now the longer mechanism, the more powerful and prolonged mechanism is salt and water retention. उसको हम जरा elaborate करते हैं. For this purpose as well, for this retention of salt and water, there is a direct mechanism and then indirect mechanism. What is direct mechanism? This is vasoconstrictor. Angiotensin is vasoconstrictor throughout the body. It will cause the vasoconstriction of the most of the efferent artery mucosa, and it will cause the vasoconstriction of efferent arteriole as well. So efferent arteriolar constriction of the kidney. बाकी body को छोड़ दें. Now we are concerned with the retention of salt and water. कैसे होती है? Vasoconstriction throughout the body causes increased peripheral resistance and increased blood pressure. Okay, we have seen in this increase in the pressure is due to that vasoconstrictor effect. But now we are going to see that is this vasoconstriction in the kidney. This will cause the decreased GFR because blood flow in the glomerulus will be reduced. Blood flow and blood pressure in the हमने एक kidney vessel going to the glomerulus हमने उसको constrict कर दिया है. And the flow in this in the glomerulus will be reduced. It will reduce the filtration process. Kidney में आपने idea तो है. If you have not discussed the kidney, but you have got idea, this is the pressure and the total blood flow, and the pressure in this glomerulus is important for the glomerular filtration rate. When this is efferent arteriolar constriction causes reduced blood flow and reduced pressure in the glomerular capillaries, and it will cause the reduced GFR. Total volume filtration 125 ml per minute, that is about 125 ml per minute, or 180 liters per 24 hours. That will be reduced. So less volume of filtrate will be formed. When this filtrate is passing through the kidney tubules, you can imagine if the filtrate was more, the passage was quick, and if the filtrate total volume has been reduced, it will be slow passage of the fluid in the tubules will occur. All the tubules, proximal tubules, loop of Henle, and distal tubule as well. So there is more time for the reabsorption of salt and water. In kidney, we will discuss when I discuss the kidney where the sodium is absorbed. Sodium is absorbed throughout the entire proximal tubule में absorb होती है. Loop of Henle में there is a special type of absorption of the salt and water हम वहाँ पे देखें, and distal tubule में some absorb. So this there will be slow passage will allow more time for the absorption of sodium and water. So there will be more reabsorption of water and salt because more time is given. It is passing through the tubule slowly, and the absorption process is taking place. It has a lot of time for the absorption. So there will be more reabsorption of salt and water in this case, and it will cause the decreased excretion of salt and water in the urine. So this is direct effect. Vasoconstrictor has resulted into the retention of salt and water. Vasoconstrictor effect in the efferent arteriole has resulted in the retention of salt and water. This is the direct action. Now indirect one, direct increase in the sodium and water absorption, this we have seen. So this is the direct action. Afferent arteriolar constriction by the vasoconstrictor effect reduces the GFR, and it will allow more reabsorption of salt and water, and the excretion of salt and water will be reduced. So direct increase in sodium and water reabsorption will occur. So it will be added to the body fluid. Indirect action, what is that? Stimulation of aldosterone. This angiotensin affects, it is causing vasoconstriction, okay, यहाँ पे भी vasoconstriction हुई है, but it also causes the stimulation of zona glomerulosa, that is the area in the adrenal cortex from where the aldosterone is being produced. So aldosterone is the main mineralocorticoid for the reabsorption of sodium, chloride, bicarbonate and water. Primarily sodium होती है, but all these are absorbed under the effect of aldosterone. Very powerful hormone. It is known as mineralocorticoid. Endocrinology may you must have discussed, or you will discuss बाद में देखेंगे. So it will cause the production of aldosterone from adrenal cortex. Zona glomerulosa of the adrenal cortex से produce होती है, and this will cause the reabsorption of sodium. Primary effect इसका यही है, but secondary to that there is absorption of chloride, there is absorption of bicarbonate, and when these particulate matter, these ions are being absorbed, automatically there will be absorption of water as well. So more absorption. This is the direct and indirect aldosterone production will cause more absorption of salts we can add. Salt, sodium chloride and bicarbonates are also absorbed, and water is absorbed by the osmotic reabsorption. So there will be more reabsorption of salt and water by both direct and indirect mechanism by the kidneys. So effects of this angiotensin on the renal output curve. You know the pressure diuresis curve or renal output curve we had discussed in the previous 2 lectures. हमने उसकी बात की हुई है. Role of kidney in the pressure diuresis, pressure natriuresis. Normal renal output curve is somewhere here. Equilibrium point, these are the 2 equilibrium points in these 2 curves. These are not normal curves. Normal curves is equilibrium point is at 100, that is going in between these like this. That is the normal renin-angiotensin system in a normal person. That the equilibrium point will be at 100 millimeter of mercury. दरमियान में होगी वो curve. You remember that curve, and यहाँ पे मैं roughly ये pencil से draw कर रहा हूँ. ऐसे होगी curve. Equilibrium point will be at 100 millimeter of mercury in a normal person. These are both abnormal condition. What is the abnormality? We have blocked the renin-angiotensin system. 0 level of the angiotensin level in blood times normal. We have blocked the renin-angiotensin system in this. So what we observe, this equilibrium point has shifted to only 70 millimeter of mercury. Without renin-angiotensin system, blood pressure will not be at 100 millimeter of mercury. Equilibrium point, renal output curve will be shifted to lower pressure sites without renin-angiotensin system. That is the important. It affects the renal output curve. Presence of renin-angiotensin system के साथ, that curve was somewhere here, ऐसे. When the normal level of angiotensin was there. So if the angiotensin system is blocked, this will cause the shifting of the equilibrium point to lower pressure side. Whole of the renal output curve will be shifted to lower pressure side. So that we use this in hypertensive patient. We use this blockage of the renin-angiotensin. We do give the ACE inhibitors to reduce the angiotensin level. So that the curve is shifted to lower pressure side and equilibrium point is shifted to somewhat lower pressure side. उनमें तो equilibrium point आगे गया होता है ना उनमें renal output जो hypertensive लोगों में. So this is the role of angiotensin. Angiotensin maintains the normal equilibrium point. If it is absent, the renal output curve will be shifted to low pressure side. Angiotensin shifts the renal output curve to high pressure levels. Equilibrium point moves to higher pressure level if the angiotensin is there. This is the 2.5 times, triple the normal level of angiotensin. 2.5 times हमने बढ़ा दिया है, तो it will shift. ये जो हमने opposite है, it will be opposite. Presence of aldosterone more than normal angiotensin. This will cause the shifting of the renal, this equilibrium point to higher pressure side, about 115, 110, but it will be 118 or 120 के करीब पहुंच गए. So this will cause, this is the importance of, this is the role of angiotensin in the long-term regulation of blood pressure. So any condition in which the angiotensin level is elevated, that will shift the renal output curve to a higher pressure side, blood pressure will be elevated, and these are the patients in which we can give ACE inhibitors. अगर इस किस्म की कोई बात हो, if there is something wrong with the kidney, we do observe that many hypertensive cases are due to some abnormalities of the kidneys. There may be more production of angiotensin in some diseases of the kidneys. So angiotensin level may be more, and renal output curve may be shifted to higher pressure side. Equilibrium point in those people may be at 110. So if we want to reduce this blood pressure, we can simply give ACE inhibitors. Angiotensin level जब वो कम करेंगे, the blood pressure will return to lower level. उसको कम कर सकते हैं. So equilibrium, angiotensin shifts the equilibrium point and the renal output curve to higher pressure side, and in the absence of this will be shifted to lower pressure side. So that is the importance of renin-angiotensin system. Angiotensin maintains the normal blood pressure. Now, again, this is summary. That is, angiotensin maintains the normal blood pressure despite variation in the salt intake. This is, again, elaborate करने की ज़रूरत है. That is, if there is excessive intake of salt, some normal person is indulged in excessive intake of salt, what will happen? There will be increased extracellular fluid volume, there will be increased blood pressure, increased blood flow to the kidneys, and renin will be reduced. Whenever a person is indulged in excessive intake of salt and water, there will be more some rise in the blood pressure, and this will cause the reduced production of renin. Or renin जब होगी, it will shift the curve to lower pressure side. जब renin नहीं होगी, angiotensin कम होगी, and the curve will be shifted to lower pressure side. जैसे हमने पिछली डायग्राम में देखे, आगे दोबारा देख लेती है. That is, so it is not going back, something wrong with my remote control. So there will be increased blood pressure will cause the decreased renin, and without renin, wo first curve, the renal output curve will be shifted to lower pressure side, and it will reduce the blood pressure. Or opposite भी apply कर ले. If salt intake is, this is a case when the person has got routinely is indulged in excessive intake of salt, so renin will be reduced in that person and to maintain the normal blood pressure. Angiotensin maintain the normal blood pressure. So इसमें ज़्यादा होने का खतरा है because of the excessive intake of salt and salt, but intact renin system, absence of renin will cause the reduction in the BP, so it will maintain. And opposite is also true. If a person is uses less amount of salt than required से भी कम खाए, so there will be decreased extracellular fluid volume because the salt is responsible for the retention of salt and water, जैसे हमने कहा. So there will be decreased extracellular fluid volume, there will be reduced blood volume and blood pressure, and there will be reduced blood flow to the kidney and reduced blood flow. अभी हम देख के आएंगे, आगे भी देखेंगे. We are going to talk about the how the hypertension develops in these people if there is something wrong with the kidneys. So there will be more renin will be produced because of the less blood flow, and this will cause the production of angiotensin. It will shift the renal output curve to higher pressure side, and there will be retention of salt and water, and blood pressure will be elevated. So angiotensin is important for the maintenance of the long-term blood pressure. This is long-term blood pressure की हम बात कर रहे हैं. So decreased BP, because when the salt is reduced, blood pressure is reduced, but renin will increase the BP. So this is how mechanism. Increase salt intake, उसी को हम explain किया हुआ है. Probably this is from your guidance में लिखा हुआ है. That is increase salt intake, increases the extracellular fluid volume, increase arterial pressure, and it decreases the renin production. And angiotensin कम होगी. There will be decreased retention of salt and water, and the return of the extracellular fluid volume to normal. जो भी salt खा रहा है, salt and water will be excreted out, and it will cause the pressure will return to the normal. So renin and angiotensin system is important in the intermediate mechanism as well as the long-term regulation of the blood pressure. This was left in that. Now last हम अभी we are going to hypertension caused by the excess angiotensin. ये भी देख लें. If the angiotensin vasoconstrictor, ये भी cause वो mechanism हम देख के आगे है. That is a vasoconstrictor, and there will be increased blood pressure. And if that will cause the retention of salt and water. That is increased extracellular fluid volume, increased blood volume, venous return, cardiac output, blood pressure. So दोनों तरीकों से cardiac output is also increased and the peripheral resistance is also increased. So hypertension can be caused by over secretion of angiotensin. अगर किसी वजह से भी हो, हम अभी देखने जा रहे हैं how the over secretion of angiotensin may occur. Now we are going to talk about the how hypertension develops. Something wrong with the kidneys. Secondary hypertension जिसको हम कहते हैं. Usually the most important cause of the hypertension, secondary hypertension, is something wrong with the kidneys. किडनी की खराबियां. तो हम उसको कैसे how this causes hypertension. This is an experiment, that is gallbladder hypertension. One kidney gallbladder hypertension. इस साइंटिस्ट ने किया क्या है? If one kidney is removed, only one kidney is left, then एक किडनी रह गया. And उस किडनी के जो रिमेनिंग किडनी तो है ही नहीं. Remaining kidney पे we place a vasoconstrictor placed on the renal artery of the remaining one kidney. जो किडनी को आर्टरी आ रही है उसको हम ब्लॉक करते हैं, कंस्ट्रिक्टर करते हैं. पहले डायग्राम में देखने. That is, this is the only kidney left and we place, this is the artery coming to the kidney. ये आर्टरी आ रही है. So we place a constrictor here. Vasoconstrictor, blood vessel को vasoconstrictor substance नहीं, this is mechanical constrictor. हम इसके ऊपर pressure डाल रहे हैं. We are compressing this vessel from outside. So blood flow, blood pressure beyond this constrictor will be reduced. There will be reduced blood flow and blood pressure in the renal artery. रीनल आर्टरी में ब्लड प्रेशर कम हो जाएगा, ब्लड फ्लो कम हो जाएगा. तो कंस्ट्रिक्टर प्लेस्ड ऑन द रीनल आर्टरी ऑफ द रिमेनिंग वन किडनी. So what has happened, that the renal arterial pressure beyond this constrictor is reduced. क्या मतलब? Reduce blood flow to the kidney, that is ischemia of the kidney. तो हमने आज की डिस्कशन शुरू यहाँ से की थी. If there is reduced blood flow to the kidney, ischemia of the kidney, that will cause the production of renin, and then the angiotensin 2 will be formed. So this ischemia of the kidney, constrictor placed on the renal artery, will cause the ischemia of the kidney, reduce blood flow to the kidney, and it will stimulate that renin angiotensin system. We are discussing the शुरू में हमने आज के लेक्चर में शुरू में हमने यही डिस्कस किया. Ischemia of the kidney reduced is due to reduced blood pressure or reduced blood flow. Here हमने blood flow को रोक दिया, कम कर दिया, ischemia पैदा कर दिया हमने, pressure fall कर दिया. So there will be renin angiotensin system will be stimulated, and it will cause the production of angiotensin 2. It will cause the angiotensin 2 के जो effect है vasoconstrictor effect and salt retention direct effect, and the indirect aldosterone effect, and the indirect as well as thirst mechanism, ADH mechanism. All that will try to increase the blood pressure. So hypertension to bring the pressure and the कितना प्रेशर चाहिए, एक ही किडनी है, कितना प्रेशर चाहिए. वी हैव प्लेस्ड ए कंस्ट्रिक्टर हियर, प्रेशर इनसाइड द रीनल, हमने ब्लड इधर से आ रहा है, प्रेशर इनसाइड दिस हैज बीन रिड्यूस, ये किडनी है, तो कितना प्रेशर रेज करें हम यहाँ पे, सो दैट दिस बियॉन्ड कंस्ट्रिक्टर प्रेशर बिकम्स नॉर्मल फॉर दिस किडनी. एक ही किडनी है, one kidney left, the pressure should be normal for this kidney, so lot of angiotensin, so hypertension will develop, blood pressure यहाँ पे pressure को normal करने के लिए back in the rest of the blood vessel there will be hypertension will be produced. Hypertension brings the pressure in the renal artery back to the almost normal, where ischemia of the kidney is released. किडनी खराब हो, किडनी को ब्लड नहीं जा रहा था, वो रेनिन पैदा करता रहेगा जब तक उसका प्रेशर नॉर्मल नहीं होता. वो प्रेशर कब नॉर्मल होगा? व्हेन द systemic pressure has risen to very high level, so that the beyond constrictor, this high level, beyond constrictor normal level is achieved. So this is how this is. We have placed a constrictor here. The blood flow here has been reduced. Renin angiotensin production will increase, and it will cause the increased pressure. Before this, beyond नहीं, यहाँ तो कम हुआ है ना, यहाँ पे the pressure normal was 100 millimeter of mercury, अब 150 होगा, तब यहाँ पे 110 होगा, 100 होगा. So there will be hypertension will be produced. This is the diagram, explain करने की जरूरत है. This is normal blood pressure. Before placing this constrictor, उस पे कंस्ट्रिक्टर लगाने से पहले नॉर्मल ब्लड प्रेशर वाज 100 millimeter of mercury. If we place a constrictor here, the distal renal arterial pressure will fall immediately. There will be fall in the pressure. This fall in the pressure will cause the production of angiotensin. Lower curve is showing the angiotensin production times normal. ये renin and secretion. Renin secretion will occur, and renin secretion will cause the production of angiotensin, but renin will increase. When we place the constrictor, there will be fall in the pressure in this vessel, that is the renal artery beyond this constrictor, and it will cause the ischemia of the kidney. Ischemia of the kidney will cause the production of renin. This renin will affect angiotensin will be produced, or that will try to increase the blood pressure by vasoconstrictor mechanism as well as the retention of salt mechanism. So pressure will rise again. Pressure will rise again, and there is a very sharp rise initially, then slow rise to about 200 millimeter of mercury. And 200 millimeter of mercury पे renal efferent arteriole will यहाँ पे pressure will return to the again the same level. जब सिस्टेमिक वेसल में प्रेशर इतना बढ़ जाएगा 200 तक जाएगा, only then the pressure in this renal efferent arteriole will be equal to 100 millimeter of mercury. So systemic arterial pressure will increase by the renin angiotensin system. कितना increase करेगा? To bring this pressure to back to normal. Ischemia of the kidney should be relieved. So that's how hypertension develops. Anything wrong with the blood flow to the kidneys, any disease of the kidney will cause this site of, that is one kidney gallbladder hypertension. This is kidney के में कोई भी खराबी हो, this mechanism may cause the hypertension. इसलिए most common cause of the secondary hypertension is something wrong with the kidneys. So this is one kidney, and when the pressure has risen to this, we can see when pressure ischemia has been relieved, angiotensin level, renin level has returned to again normal. And when we release this constrictor, जब इस constrictor को remove करेंगे, what will happen? The constrictor is removed here, the pressure will rise. This in the renal efferent arteriole, जब ये हटाएंगे, यहाँ तो 200 millimeter mercury pressure था, तो ये भी 200 हो जाएगा. So it will rise again, but because of absence of this, there will be more excretion of salt and water. It will return in next a few days to the again 100 level. This is experiment to show how the hypertension develops something when something is wrong with the kidney. This is one kidney gallbladder hypertension. अब इसको apply करने के लिए 2 kidney वन किडनी गोल ब्लैडर हाइपरटेंशन, ये आई एक्सप्लेन्ड इट, ये लिखा हुआ भी आ गया. दैट इज इनिशियल राइज इन द प्रेशर इज वेरी रैपिड, जो हमने शुरू में देखा. दिस इनिशियल राइज इज वेरी रैपिड, दिस इज बिकॉज ऑफ द वेजोकंस्ट्रिक्टर इफेक्ट ऑफ एंजियोटेंसिन 2 और लेटर ऑन द रिटेंशन ऑफ साल्ट एंड वाटर. दिस स्टीप राइज जो है ये वेजोकंस्ट्रिक्टर इफेक्ट है और फिर रिटेंशन ऑफ साल्ट एंड वाटर विच इज स्लो. So initial rise is due to the immediate release of renin and vasoconstrictor angiotensin 2, it will cause the vasoconstriction. और फिर बाद में later slow and prolonged rise in the pressure is due to the direct effect of angiotensin on the renal retention of salt and water, and indirect effect through the production of aldosterone. Salt and water retention will be occurring. So this is how the hypertension will be produced. अब इसको अप्लाई करें एक और कंडीशन में, 2 किडनी गोल ब्लैडर हाइपरटेंशन. इसमें क्या किया एक्सपेरिमेंट में, रीनल आर्टरी ऑफ 1 किडनी इज कंस्ट्रिक्टेड, दूसरा किडनी नॉर्मल मौजूद है. पहले एक्सपेरिमेंट में वी हैड रिमूव दी only one kidney was left. Now the both kidneys are intact. In 1 kidney we have placed a constrictor. तो क्या होगा, in this kidney 1 kidney gallbladder hypertension should develop. ये वही काम होगा. So renal artery of the 1 kidney is constricted and salt and water retention by this ischemic kidney, जो अभी हम डिस्कस करके आएंगे. 1 kidney gallbladder hypertension will occur because of decreased GFR. There will be decrease renal efferent arterial pressure is fall, and there is reduction in the FAR, and there will be retention of salt and water by this kidney जो हम डिस्कस करके आ गए हैं. 1 kidney gallbladder hypertension जिसमें हमने कंस्ट्रिक्टर लगाया. किस वजह से? बिकॉज ऑफ द फॉल इन द GFR. इस्कीमिया, यहाँ ब्लड फ्लो कम हो गया तो उसकी वजह से रिटेंशन ऑफ साल्ट वाटर, बट दिस फ्लो causes production of angiotensin, and that angiotensin affects the second kidney as well. That is salt and water retention by the normal kidney, by the renin from the ischemic kidney, causing the production of more aldosterone as well. So इससे जो renin produce हुआ है, angiotensin produce हुआ है, that will affect the production of aldosterone. Adrenal cortex को तो नहीं पता कि ये adrenal cortex, whenever there is more angiotensin available, adrenal cortex will produce aldosterone. Aldosterone will cause the absorption of salt and water by the normal kidney as well. वो तो दोनों पे इफेक्ट कर रहा होगा. तो नॉर्मल किडनी से भी देयर विल बी रिटेंशन ऑफ साल्ट एंड वाटर. तो जिस पे हमने कंस्ट्रिक्टर लगाया है उस पे हमने GFR को कम करके रिटेंशन ऑफ साल्ट एंड वाटर हो गया है, एंड द अदर नॉर्मल किडनी इज काजिंग द रिटेंशन ऑफ साल्ट एंड वाटर बाय द इनडायरेक्ट मैकेनिज्म बाय द एल्डोस्टेरोन प्रोडक्शन फ्रॉम द एड्रेनल कॉर्टेक्स. तो इस दोनों किडनी, बोथ किडनीज विल कंट्रीब्यूट टुवर्ड द प्रोडक्शन ऑफ हाइपरटेंशन. तो होता यही है, साल्ट एंड वाटर रिटेंशन बाय द नॉर्मल किडनी. तो हाइपरटेंशन इन रीनल डिजीजेज में यही 2 किडनी गोल ब्लैडर हाइपरटेंशन होती है. दिस इज प्रोबेबली आवर लास्ट स्लाइड. हम देखते हैं दैट इज डिजीज आर पार्शियली डैमेज किडनी प्रोड्यूसेस हाइपरटेंशन सिमिलर टू 2 किडनी गोल ब्लैडर हाइपरटेंशन, कि जिस जगह पे ब्लड फ्लो कम है वहां पे GFR इज रिड्यूस, और जहां पे ब्लड फ्लो नहीं कम देयर इज दी एंजियोटेंसिन. दैट इज डिजीज आर पार्शियली डैमेज किडनी प्रोड्यूसेस हाइपरटेंशन similar to 2 kidney gallbladder hypertension. Damage at ischemic area due to decreased GFR. Ischemic area में there is decreased GFR and retention of salt and water. और बाकी किडनी में normal area because of the production of renin from this damaged area will cause the retention of salt and water. Renin angiotensin system produces diseased area. So gallbladder hypertension develops in most of the renal kidney diseases. Kidney diseases में इस तरह hypertension develop होती है. That's all. We discussed the long-term regulation of blood pressure in these 3 lectures we had taken. Next time we are going to start another very important topic, that is the cardiac output and its regulation. Next video में वो भी हम 1 या 2 lecture में discuss करेंगे. Next हम cardiac output को discuss करेंगे. And thank you very much. अगर आपको समझ आ रही है, well and good. If you have got some questions, queries, you can ask in comment section. Please do subscribe and share my videos so that most of the people can benefit from it. Thank you so much.